Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, and urgent care, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our health talk today is very interesting. We have somebody who is a survival from the two cancers, Mr. Andy Aubrey. He is in sales and the manufacturing with the Detroit Diversified Product. He is the CEO there. And he is going to share his life story, some of the facts, how he survived the two major cancers. And this will be a good tape for everybody to watch, because the cancers are being diagnosed at earlier and earlier age, and sooner the diagnosis is made, better it is. So good morning, Andy, and welcome to my show.
Well, thank you, Doctor. I'm glad to be here.
Yeah, before we start, can you give your biodata, some short introduction about yourself, Andy?
Sure, I'm happy to do that. I've been in manufacturing sales, as you mentioned, for 38 years or so now. I have my own agency I work for, but I became ill for the first time, which is why we're here to discuss that. Back in 2003, I had some pain that was a little abnormal, and I saw a doctor who suggested that we get a colonoscopy, which was young for 39 to try, but something wasn't right, and I had some blood work which revealed anemia, and so my what helped me out with the blood work term, hemoglobin was low, and so they felt there was a blood loss somewhere.
And you looked pale and jaundiced.
I was pale, I was tired, and there were some things that in hindsight I should have given more credence to, but eventually through colonoscopy they determined I had a 6.5 centimeter tumor in my the ascending portion of my colon. So subsequently, within a week, had surgery. They did a laparoscopic procedure to remove that tumor, and I had a precautionary chemo regimen that lasted around 8 months, and I moved on. But 15 years later, checked into 2019, I had another cancer, this time in my duodenum, that was stomach cancer, and had what was known as a Whipple procedure, which is a very invasive procedure to remove a good portion of my stomach and small intestine. And luckily, that had not spread, thank God, and I'm here to talk about it now.
So, Andy, I did some studies and all that. This is not my specialty. This Whipple's procedure, basically, they do it for pancreatic cancer. But they decided to do it for the ascending colon tumor. Is that because the tumor was invading the wall of the stomach, some area?
Correct. Well, that was the colon cancer in 2003. The tumor had buckled outside the wall of the colon, and was up against my liver, but that wasn't for the Whipple. The Whipple was for my stomach cancer, and that was when I had the tumor in my duodenum, I guess you could say it either way. But they did take a portion of my pancreas, to your point, and also half my stomach.
The mucosa of the duodenum and the stomach area, that's where the tumor started.
That's correct. Yeah, it was in that area that went from the stomach in to the intestines. So
But then when you had this Whipple trial, that procedure worked good for you?
It was pretty good. That's I'm told that's one of the most invasive surgeries you can have, short of a heart or a liver transplant. I
know.
It was about a 10-hour procedure. And
I was reading about it, and then I had some beautiful picture also. They showed how they remove it, but
I've got a big scar.
Like a surgeon.
You don't want to see me on a beach for a lot of reasons, but the scar I have in my stomach is very invasive. Yeah, it's about 12 inches. So, and luckily, again, it hadn't spread that time. It was stage 1B to 2 area, and my surgeon didn't feel it was important. But the risk for infection is very high with that procedure. And in fact, they did have to go in 2 weeks later because I was sepsis. I had sepsis. So when I was septic, they had to reconnect and seal up some things. A couple weeks after my initial Whipple procedure, and then I had a wound vac for about a month at that point as well.
It was open.
Yes, yeah, that's correct.
Open wound.
Right. Yeah.
You must have received a lot of antibiotics, right?
Absolutely, yeah. Mirapenem. I was on a IV drip for 2 weeks after this second procedure. Yeah, yeah, very, very dangerous for infection, correct. So, and I want to shout out to my wife, Dawn, who maybe we can speak about what she does at some point here today, but she was an angel to me for getting me through that. She was my live-in 24-hour nurse, quite frankly. And because it's changing IV bags, there's a lot required to, just keep you healthy.
Offhand, do you remember which antibiotic had the best prognosis on you? Are you responded to which one?
Well,
Maybe
I get Mirapenem comes to mind as the one.
Generation cephalosporins.
Yeah, it's a little foggy. In some ways, I try and push some of that out of my mind. It was just a dark period of my life, but I'm stronger for it. I think because now the smallest thing that happens to you in life doesn't seem so big after I went through all that. Taught me a great lesson to not obsess over the little stuff.
No, you cannot, because God has been kind.
Well, that's why I'm here today too.
Survival, and you want to give advice to our young age people. Urge people to schedule colonoscopy, which is so important.
It's critical. It's absolutely critical, and that's one of those things you can put that off. I'll do it next month. I'll do it next week, next month, next year. And you can't do that, folks. Go in and get those colonoscopies, even checkups, regular physicals, absolutely critical to catching cancers early because, as you know, you have a better success rate the earlier you catch these things. Yeah.
So when we get the colonoscopy, from my experience working at emergency room, urgent care, pediatric, there is a condition, diverticulitis versus diverticulosis, where there are pouches.
That's right.
So I hear the pouches are more benign.
That's what I understand as well. That the pustules, I guess they're called, of inflammation can expand into polyps and then a tumor, which is probably what happened here.
The small polyps are there.
Yeah. So it's like little, as it's been described to me, small like pits inside your intestine that is pieces of food that can lodge there, and then they don't dislodge, which is why a high fiber diet is important. I stay away from seeds and nuts and so forth.
Yeah, we are going to come about the diet thing. So right now, I see the juveniles, they come to the emergency room with all those features of diverticulitis, which is more dangerous than just getting those pouches. And so there might be some incidence of cancer with diverticulitis, right?
That's what I'm told. Yeah, that's correct. And it's quite painful. I mean, I've had, swelling in my midsection when I have a flare-up, and it's painful. And I look back, sometimes they say stress can bring that on. Other times it's your diet in conjunction with stress. You never really can tell. It's an unknown commodity for me.
Excuse me.
Yeah, but
now I'd like to ask you another question. And some of these cancers or whatever, these are genetics.
That's correct.
And I believe there might be an incidence of Clinch syndrome.
Yeah.
Will you kindly explain our viewers about this?
Sure. As I understand it, genetic testing wasn't widely done until around the year 2000, and now that's picking up steam more. But when they saw another cancer in me, my surgeons suggested I see a geneticist who I did a full panel screen of genetic testing, which is where they discovered the Lynch, and they also wanted my children tested because the benefit there is if you know you're Lynch positive, you can undergo sort of what they call active surveillance. In other words,
got you.
I have a colonoscopy annually now. So does my daughter because she's Lynch positive.
So this is one of the genetic things.
Yeah, that's correct. And I do have, in hereditary wise, I had a number of cancers in my direct immediate family, my mom's sister, both my grandparents, and so they looked into that as being this comes down the line. And the good news some people say, "Oh, I don't want to know any of that," but knowledge is power, right?
You have to know.
We know now that we know that this is positive, you can get more testing done and catch, God forbid, a cancer that comes again early.
There has been so much recent advances, changes, in the size of the genetic testing itself. They can pinpoint where is your your gene, which is abnormal.
That's correct. Yeah. Right. Yeah. So, I'm in there faithfully, and aside on health insurance, they will cover an annual colonoscopy. Normally would not. They look for every 5 years, right?
Right.
But if you are Lynch positive, then your most plans will go ahead and cover endoscopies and colonoscopies yearly.
So for our viewers to know that all these things are covered by most of the major insurers, right?
Yeah, that's the object. Yeah. See, because the colonoscopy, it's not cheap if you pay out of pocket, of course.
I know.
But
it helps. Colonoscopy helps in detecting early signs of cancer.
Absolutely life-saving, 100%. Yeah, right. Absolutely right. And again, that's another reason I'm here today, is to motivate people. I want people to know if you've been diagnosed with cancer,
yes.
You can survive that. It's a scary thought when you first learn about it. You think the worst. But you hear about a survivor, especially a 2-time survivor. And I hope to give people some encouragement and some hope that it's going to be okay.
Yeah, so that's good. Now, would you advise about your viewers about the diet? Because I know you must be on a limited diet regime, right?
Yeah, I do. It's not as invasive as you might imagine. I did cut back on red meat.
Okay.
I did a lot of research on red meat has more fat in it. Fat is where some of the things they use in cattle farms
pasteurized
can stay in the fat. So like leaner meat.
I forget the name. What is that thing they found in the red meat? That dye?
Oh, there's dye. There's hormones, growth hormones, antibiotics, things they use in cattle farms.
That is carcinogenic.
Absolutely right. Yeah, that's correct. And so my original Dr. Tutla told me to stick towards seafood, stay with white meats like turkey and chicken.
Right.
Because it's leaner, there's less fat involved. As much as anyone might like a great steak, a big T-bone steak. There's a lot of fat, ribs, things like that.
Steak with mushroom sauce.
Oh, it sounds great. I'm getting hungry, Doc. You're making me hungry over here.
Oh my God! With the mushroom sauce and potatoes by the side.
Lots of butter. Yeah, it's. I guess you could say everything in moderation. I will have a steak now and then because there's good iron involved and vitamin A and so forth. But I've dialed back on a lot of my beef consumption. And again, seeds, there's varying studies on whether seeds and nuts and popcorn and things like that can lodge if you have diverticulosis, but I've pretty much wiped them out just to be on the safe side.
On the safe side,
Right.
So try to avoid the seeds because the seeds are able to go settle in the...
Yeah, those are the things that can settle. I had Dr. Tutla tell me one time that your colon and intestine system is kind of like a phone cord. If anybody remembers phone cords, we don't have them anymore, but the stretchy kind that we had back in the day, you know. But it's within those spirals and that waviness of the makeup of the inside of your colon that is where those seeds can lodge.
Right.
So that's why fiber is important. I drink or eat more whole foods now.
You don't want to be constipated, right?
Absolutely.
That is another issue. Don't be constipated.
Yeah.
Because if somebody is constipated, they will strain and get another problems.
Yep, that's correct too. Yeah, right.
Like hemorrhoid. So basically, is you have to balance.
That's correct. Balancing things in moderation, higher fiber diets, legumes and so forth, and hopefully things work out for you. But again, I really mainly want to stress today how cancer caught early enough is survivable, and also. This is also important, Doctor. We see where people come into the doctor with a pain that they had for a year or two or more that they didn't address it.
Nobody pays attention.
Well, that's it. They think it's normal to have a pain in your side.
Intestinal flu, yeah.
For me, I felt like my first cancer, I had like a golf ball in my pocket, is what it felt like. And I go to the gym, so I was noticing that, and something just wasn't right. And if you exercise on a regular basis, that helps, because had I not, I would have really never paid as much attention to it. And I'd look at the mirror and I'd look and something just wasn't quite right. So thankfully I did jump on that, because my wife tells me all the time of the people that came in with an ache or a pain that they'd had for years, and by now they're cancer stage 3 or 4. It's spread to other organs, and there's really not much they can do. So
right, yeah. So early diagnosis, early detection.
Yes.
And proper diagnostic evaluation.
Right. Yeah, exactly right. And they keep lowering the age of colonoscopies that they recommend.
Right,
I think it's down to 45 or 50 now. It was
now it is
in the 50s or beyond. Because they're seeing so much of this cancer. We don't know what it's about. Is it environmental? Is it the additives in the foods?
Yeah, the
I mean,
food
that's being studied right now, I know.
Would you comment about the eating fish, shellfish? Does it aggravate?
Well, at some point we're going to run out of things to eat, because there's so much in so much of everything.
Because so much about what written up about eating too much salmon, the mercury.
Yeah. That's correct.
Mercury.
Yeah. So what do you do, right? I mean, we're gonna just. It's a tough one, but there again, I think that goes into moderation. So if I have a steak now and again, it's not bad. If I eat steak every day or sausage, that is bad.
It's bad, right.
Seafood. They've done studies on people who just had sushi, and they had high elevated mercury levels in their system, speaking to your point.
Yeah.
So, if you have a plate of sushi now and again, maybe not bad, but if you eat it every day, so you don't want to do that. But seafood was recommended for me for its high protein content and low fat.
Yeah, less fat.
Or less fat, right. Especially, like you mentioned, salmon, and there's been studies about the healthfulness of salmon and the omega-3 fatty acids.
Omega-3, yeah. I was going to ask you about this omega-3 thing. That was my next question.
Yeah,
so
right.
Whatever you do, there's some advantage and disadvantage, right?
Yeah, I guess stick with avocados. They have the same fat system in there, I guess. But
avocado. I like avocado.
Those are really getting popular. People are going towards avocado, I think, for that reason. Because that's
of
helpful.
The omega-3.
Absolutely. Yeah, that's true. Right? So just eat avocados every day, apparently.
Toast and avocado. Tomato.
Yeah.
Tomato and avocado, right?
Fruits and vegetables, very important. I don't think anybody eats enough fruits and vegetables, except maybe vegetarians. But, there's been studies done on a vegetarian diet that there's pros and cons to everything, I think.
Would you comment about organic versus non-organic food when we go to grocery store? Which one would you advise our viewers?
That's a good question. This is my own personal preference. I think it's probably better. It's more expensive. But, the idea being there's less pesticides, herbicides, and fertilizers, chemically induced growth processes used in the growing of fruits and vegetables that are organic. I think if you look at a pear that's, there's certain vegetables, as I read, that are more, they use more pesticides on. Apples, grapes, blueberries. Pears are among the worst, I guess, versus just commercially grown products. But I do buy organic when I can. Other times it's a lot more expensive.
Very expensive, side by side. You know. One spinach there is $5-6. Other side it is $2-3.
Yeah, exactly.
For
and also
average individual, it's very hard to.
Correct. And another thing I had learned is that a fruit with a husk or an outer, like a banana, for instance, you may not need it may not be as important to have organic because you peel that banana and you throw it out. Same with an avocado.
Right.
The core, the oranges, and so forth. You're eating what's inside. But a pear or an apple or a grape, you're eating everything that's been grown and sprayed upon. So. Again, I haven't done enough research on organics other than my own shopping habits, and I do appreciate the opportunity to buy it when I can, though.
Yeah. So, in other words, for our viewers to know, you would be advising more fruits which are covered with a shell, like a banana.
As far as
like a banana, you just peel off the skin and eat, or avocados, those, rather than grapes, because grapes are open.
Grapes are open, apples are open. They spray and they spray because bugs love them too. So that's why they spray so much of them, so they don't. They're able to sell them and they don't have holes in them.
Right.
So. There's a lot going on that we don't know about, I'm afraid, unless you're an actual farmer,
You said it, yes. Farmers,
But, they're trying to increase their yield, and they don't want the bugs to eat their crops. It's as simple as that, so they use methods that may not be very healthy for us. That's the whole problem there. So, but, I guess, again, main point here being the more fruits and vegetables you eat, the better it is for you.
The more you eat,
Yeah, and again, fiber, peaches are very high in fiber. And other certain fruits and vegetables. And the more you can make yourself regular, we'll say, the better your gut health will be, is sort of the mission here.
Yeah, pomegranate, that is a good one to eat, right?
Absolutely.
It is shelled. The only thing is with a pomegranate, you have seeds.
There again. There's those seeds again. We can't get away from them.
What are you going to do?
Yeah, Even seedless watermelon has seeds, those little white ones now,
Watermelon, yes.
But watermelon is good for you. Anything you can increase your water intake and drinking more water. We hear about that, right?
Do you drink watermelon?
Absolutely. Right here, folks. H2O, and it's good. That's good for digestion. And I don't know that everybody drinks enough water. They say 8 ounce glasses a day. I'm not sure how much of that everybody gets.
Water. Okay.
But
any comment about the consumption of eggs in your diet?
Well, I guess maybe that's a matter. I'm not a dietitian. I think eggs, the latest I've read is that eggs, they're okay for you, again, in moderation. You want to eat 10 eggs a day, but they, depending on your personal health, cholesterol levels, and so forth, they're high in protein.
I get rid of the yellow part.
Okay, just the egg white?
Mostly the white,
I think it's probably healthier that way.
That is more healthy,
Yeah. What's your diet like?
My diet, mostly vegetarian. I don't care too much for meat.
Okay.
Yeah, mostly. We don't eat beef, other religion back from India.
Right.
But the children, they eat everything.
Yeah.
So I cook for them.
Well, they say if the ingredient panel on a package is longer than an inch and has a lot of words you can't pronounce, that's probably not very healthy for you.
Exactly.
As well as the way they lay out the grocery stores. I've also been told the outer rim is the healthier, whether it's meat, dairy, and so forth.
Meat, dairy.
And the center aisles are all canned goods and processed foods. So, but again, if you want to have a Twinkie now and then, only have one, not the whole box.
Right, you can
it's
have
all
one.
about moderation, I think.
Yeah, and also, you are a sportscaster, so you see all those young athletes.
Yeah.
And they need a lot of advice about what they eat, right?
Yeah, because I don't
The
think
high energy.
right. Young people aren't famous for having very healthy diets. If my
Yeah,
son is
they
any
are.
indication,
Yeah.
they go to a lot of fast food. They're always on the run. McDonald's, Taco Bell, and all so on, but not very healthy. It's just try to be mindful, I guess, of how you're living your life in a holistic sense, whether
Right.
that's exercising or eating right.
Yeah.
Even alcohol intake, you just have to be careful with
we
the
haven't
amount of
touched
everything.
the alcohol, but everything in moderation.
Absolutely.
You can have alcohol, but not a whole lot.
Yeah, no binge drinking. Occasional beer now and
Right,
then, maybe.
yeah, no
but
binge.
wine, they say red wine can have good antioxidants, right?
You will be surprised. Most of all my Indian friends, everybody drinks red wine.
Yeah. It's just right. It's a lot of antioxidants. You mentioned
They
it.
say that red wine is good.
Right. It's those free radicals inside you that you're trying to.
Yeah.
And that's, where the antioxidants combat that. Whether it's grape juice, red, grapes we mentioned earlier.
Right.
Anything with color is good. And even blackberries and raspberries, as long as you don't have diverticulitis, are very healthy for your system.
So last minute question, could you comment about the mind and body syndrome, meditation, spiritual health?
Yeah, and I'm really glad you brought that up because
Right, yeah.
it's what got me through both journeys. I mentioned working out. I was able to drag myself into the gym, and just enough to get my heart rate elevated, even through my chemotherapy sessions, was incredibly important to keeping me feeling some semblance of normalcy. Stay with your routines if you can. And as important as keeping your body strong during those times, it's up here processing the news that you have cancer and getting through it the best way you can. Is that going to church? Maybe. Is it meditation? Possibly. Is it seeing a therapist?
Yeah.
There's a lot of good support groups out there that can help you talk through what you're feeling, and that can help you get through all of this.
Yoga and meditation. So I like to thank you, Andy, for coming to my show, your cancer journey you went through, and you provided a lot of information for our viewers about early diagnosis, emphasize like young age group, do a colonoscopy plus follow your diet, and then of course meditation, spiritual health. We also talked about the diet situation.
Yes.
So I like to thank our viewers for watching me this show today. I like to thank our camera people for helping me prepare this video. And until I see you all, have a very safe, wonderful holidays. Thank you again.
Thank you, Doctor. It's been a
Wonderful.
pleasure.